If you manage a medical practice, you already know the truth about your PointClickCare queue. It is never actually empty. The moment you close one task, 3 more take its place: a delayed entry, a missing signature, or a documentation gap. When that backlog gets large enough, it inevitably spills over. Highly paid physicians are forced to step in and perform basic data entry just to keep the clinic functioning. This chart tracks the severe imbalance in a provider's day. According to the AMA and data from Epic's Signal platform, for every 8 hours of scheduled patient care, ambulatory care physicians spend an average of 5.8 hours inside the EHR. A large portion of that bleeds into the evening, the pajama time researchers have identified as a primary cause of stress. It happens because the people managing the system during the day are usually front desk generalists who lack the dedicated bandwidth to keep up. Treating specialized EHR tasks as a generic front desk duty slows down your billing and creates a measurable structural driver of physician burnout. To solve that backlog, the default playbook is to hire an in-house EHR coordinator. You look at the job boards, see a base salary of around $35,000, and assume that is your total cost. But as this waterfall chart shows, that base salary is just the floor. You have to add $8,500 for benefits, $2,700 for payroll taxes, plus thousands more for office space, equipment, and paid time off. Then you factor in turnover. Medical Group Management Association data shows a 40% turnover rate for front office staff in 2022. When they leave, the recruitment, onboarding, and lost productivity penalty costs between $25,000 and $30,000 per departure. Add the annualized turnover risk, and the true loaded cost of keeping a single US-based in-house EHR coordinator reaches $60,800 a year. The financial hit is only half the problem. Every time someone quits, they take weeks of specialized workflow training and accumulated institutional knowledge with them, leaving you with an operational vacuum. Mid-sized practices cannot hire their way out of this crisis because the traditional in-house staffing model is mathematically broken. Many practices are finding relief by stepping off the hiring treadmill and partnering with outsourced virtual medical assistant teams. Staffingly provides dedicated PointClickCare virtual assistants functioning as a direct, remote extension of your existing team. Unlike an in-house medical assistant who is constantly pulled away to answer phones or greet patients, these specialists own one singular function: EHR accuracy. They work during your business hours, logging directly into your existing EHR environment using secure credentials. The service maintains enterprise-grade security protocols, including HIPAA, SOC 2 Type 2, ISO 27001, and HIT Trust certifications. This model allows you to replace the inconsistency of a distracted generalist with the reliability of a highly focused, compliant specialist. Generic EHR experience isn't enough. PointClickCare requires deep familiarity with your specific clinical workflows and your distinct patient population. To address this, Staffingly ensures every dedicated team completes 40 or more hours of orientation focused exclusively on your practice's unique rules before they ever touch a live task. These specialists use AI-powered quality gates. Documents pass through a scanning note that extracts key data and flags redundancies in red. Catching these errors, which cause 43% of usability problems, and deleting them prevents costly downstream claim denials. You also maintain complete oversight. The management structure provides daily performance reports from a dedicated team leader and customer success manager, so you always know exactly what was processed. Combining 40 hours of custom training with automated error checking creates a documentation pipeline that is far more rigorous than what an understaffed front desk can physically provide. Now, consider the financial contrast against that $60,800 true cost of an in-house hire. Staffingly's dedicated model costs $21,600 a year for a single virtual medical assistant covering 45 hours a week. That produces an annual savings of $39,200, a 64% cost reduction per position. This price is fully inclusive. Step off the costly hiring treadmill. Book a demo today to ensure your EHR workflow finally keeps pace with your patient volume.